talk about how you can get some relief from your plantar fasciitis. So the plantar fascia is actually a really, really thick band of connective tissue. It starts on the inside of the heel and goes all the way up to the base of the foot, so it stops right before the ball of the foot there. The really tricky thing about the plantar fascia is, like I said, it's connective tissue, so it doesn't have very good blood flow. So in order to get that to actually release, you really need to do something to get that blood flow going. So a lot of people will use ice, or they'll roll their foot on a frozen water bottle, but that's actually not helping you at all. So one of the things that I really like to do, and it's really easy to do at home, is something called instrument-assisted soft tissue mobilization. A really long word, just remember that. It's really just soft tissue work using something to help you, okay? You can use at home a door hinge, like the flat edge of the door hinge. I've had people use a butter knife, the non-serrated edge of the butter knife. But what you want to do is take the tool that you're going to use, and you're going to actually scrape. And you'll feel, and I can certainly feel it in my foot right now, that it's a little crunchy. So you're going to go in one direction. That's actually really important. And you can play around with it and see which direction feels crunchier or sounds crunchier to me. It's this way right here. So you're going to do that. It doesn't take long. It's really just until that foot gets a little bit redder. Then you'll know that you're getting some nice, good blood flow going through there. Once you're done with that, you want to think about moving up the leg a little bit. A lot of times with plantar fasciitis, the calf muscles get really, really tight. So in order to actually fix the foot, you have to look up a little bit above that. So two really easy ways to work on that are this lovely thing called a stick. At home you can easily use a rolling pin instead. But you're literally going to roll out those muscles. And you will feel, if you've got some knots in there, it's not going to feel great. You want to play around with it a little bit and try to get the inside, the back, and the outside. You're going to roll that muscle wherever it feels the most tender. You're going to do it as long as it takes to actually feel not as uncomfortable anymore. And that, of course, is going to vary for every single person because we all have different bodies. If you find that you have one really tight, yucky, awful spot, you can take a ball, a lacrosse ball, a tennis ball, put it right underneath that spot, and when you find that spot, take that ankle, and you're going to pump right up and down. If you need to, sometimes you need to use the other leg to help support so that the ball doesn't fly away from you, and just cross over. Ooh. And same thing, you're going to do it until it doesn't feel quite as bad. So that's a really common cause of some of that plantar fasciitis. The other issue that I see a lot is people actually have some tightness right through the joint, not just the muscle. And we want to make sure that we address both of those things so you can make this go away. So, in order to get the joint to move a little bit more, you want to take a really sturdy band. And if you don't have that at home, you can take a strap or even a sheet or a belt, something with not a lot of give to it. Attach it to something nice and sturdy. And I'm going to take the band that I have, and that's going to go right around the front of the foot there. So it's right at my ankle. And again, if it's got a little give, pull away from it so that you are having very, very little give left to that band. Really make sure to keep that heel glued down to the ground, and then you're going to bend into that knee and pull back. And I'm even getting some little pops in there, meaning that joint's really starting to move and loosen up. I tell people about 15 to 20 repetitions a couple times a day. You can even take this band and place it and turn around. Same position, you may have just heard that little crack right there. And actually get through the back so that you're just getting the joint at a little bit of a different angle. Same thing, 15 to 20 repetitions. So those are 3 quick, really pretty easy things that you can do to start to get some relief through the bottom of that foot. Thank you so much for joining in today. I'm Dr. K with Momentum Physical Therapy and Fitness. Check out my YouTube page if you want more information.